The International Chiropractic Association X-ray diagnostic guidelines, when followed properly, just may be the solution to establishing the cause of acute and chronic spinal pain. There are approximately 313 million Americans living in the United States today, each pursuing their dreams in a pain-free manner. In a 2011 report, the National Institute of Health reports that 116 million Americans suffer from chronic pain. Much of the pain comes from spinal soft tissue injuries occurring from unanticipated events. These events, while not always life-threatening, can lead to life-debilitating injuries. Sometimes we're injured in activities of our own choice. These injuries then take us into the maze of choices that have cost many their freedom by causing chronic, lifelong painful results. What type of doctor is right? Is the doctor good? Is the treatment right? How do I know? These injuries, when not resolved in an efficient and effective manner, have a way of reducing our functional capabilities to work at our jobs. They can reduce our ability to earn our livings. They often affect our ability to do many of the activities that we most enjoy. Our play, our recreation, our activities of daily living that have purpose for us, the activities that make our lives so enjoyable. More importantly, these injuries come with a very high risk of long-term residual complaints that can cause a lifetime of headaches, a lifetime of chronic neck pain, a lifetime of chronic lower back pain. These conditions are often unnecessary and always unwanted. Today, more than ever, it's important to get out of the maze of providers and choices. Get out of the environment that has produced 116 million Americans to have chronic pain. The key, of course, is finding a doctor who understands these types of injuries and can properly diagnose your condition immediately. As a matter of fact, time is of the essence, because the longer the condition goes undiagnosed, the longer the possibility that it will never fully go away or you'll never fully recover. So if proper diagnosis is the key, then it's important to get an accurate diagnosis. Accurate diagnosis is like getting the address correct and loaded into your GPS or direction system. With a proper starting address, you can program the most efficient and effective path to get to where you want to go, which is, of course, pain-free. For any doctor of the spine, the main tool to assess your spine with is, of course, called an X-ray. The standard X-ray series with stress radiographs included can now fulfill what the ICA X-ray Guidelines intended the provider to be able to determine. Let's look now at the three most important assessments the ICA says needs to be determined from X-ray, which are a subluxation assessment, a spinal soft tissue injury assessment, and a spinal instability assessment. Now let's apply what we've learned to the actual X-rays. We see here the spine is abnormally straight, which is a sign of injury unto itself, as it should be in a more optimal or normal forward curved position. Now we know that global misalignment patterns, such as loss of spinal curves, are a sign of intersegmental motion abnormalities, usually caused by spinal ligament injuries. A CRMA readout tells us, in this case, the intersegmental offsets in the neutral are simply not that bad. So we must look to the flexion extension X-ray or stress views to determine where the abnormal intersegmental motion units are. Anywhere there's any abnormal motion, there can be misalignment that causes interference to the spinal nerve or causes pain. When we have a situation where these misalignments now cause pain or interferes with the nerve's ability to function, we call that condition a spinal subluxation. We can also call it a spinal instability, as the spine is both misaligned and has reduced its capability to remain stable. Here in the flexion view, we can now see that our loss of curve that is present in a CRMA intersegmental motion study. We show that we have significant ligament damage indicated by the C4-C5 spinal motion unit. The extension view with the flexion view now allows the CRMA study to determine how much translation or sliding back and forth there is intersegmentally. Now, you may not think that such small offsets measured in millimeters causing spinal subluxations and spinal instabilities could cause so much trouble. Look at the spine and the spinal motion units and look how tightly everything from the blood vessels to the nerves are packed into a tightly organized space. millimeters actually do matter. So today, more than ever, it's important to find a doctor that knows how to assess for these spinal ligament injuries and can get you the accurate diagnosis that you may be missing. This doctor then becomes ultra important, as it usually is only with an accurate diagnosis that the journey back to being pain-free can begin.